patient to attempt this approach, notably one who is very curious and very interested in experimenting with the face mask, which is, that's a special breed of patient for sure. Okay, and this is a very interesting face mask design that the patient shared with me that him and his dad built. So he has built this off of his bed frame, and he sleeps connected to this thing, and it works all night. So yeah, this is the kind of patient that is into face masks, is the kind that would build their own to get the most out of it. And by the way, this is another issue with face masks, is that there's not a lot of consensus on which device to actually use to pull things forward, but Dr. Khan's bow is definitely one of the best. So shout out to Dr. Khan is like the Tony Stark of orthodontic compliance stuff. She has all the cool inventions. Okay. Option 3, Marpe, so the nasal maxillary expander, plus a one-piece maxilla and one-piece mandibular surgery. So this is the third approach to three-dimensional jaw maxillism, and it's Marpe followed by one-piece upper and one-piece lower. This approach is great for those who aren't sure if they are true maxillists yet, because they have the option to bow out of jaw surgery completely if the Marpe gets them what they're looking for. That could mean enough nasal breathing improvement and tongue space to go on living, or maybe from an aesthetic point of view, they are happy to have a wider, more Hollywood smile that the Marpe gives them, and sharper cheekbones, and can do without the big side profile change that the jaw surgery gets you. But if they feel like the Marpe wasn't enough, and they still want the surgical advancement, now they can take a simplified approach to surgery by doing a one-piece upper jaw surgery, which is simple, harder to watch, and has less risk of damaging the health of the teeth, and also a lower infection risk because there's less surgical plates. As we will see with the multi-piece maxillary surgeries, there's more plates involved. And plates are often the site of post-surgical infection. So a one-piece upper jaw surgery is also a faster surgery, which means less tissue jostling, less anesthesia, etc., which all translates to a faster recovery. Of course, the recovery is the scariest part for prospective jaw surgery patients, because could you imagine waking up from that and having your face having been hacked off and having to deal with that experience and that pain? And, it's scary. So anything we can do to make that easier, I think, is going to open the door to these procedures for more people. And finally, the last advantage of this approach, and perhaps the most important, is that the Marpe may give certain nasal breathing benefits that orthodontic surgery simply cannot. Specifically, it can expand the nasal volume vertically along the y-axis of the nose, because it spreads the nose basically all the way up to the base of the eyes, as opposed to jaw surgery, which only expands the nose up to the height of the LaForte cut. Higher LaForte cuts, as part of a segmental LaForte approach, may approach the effectiveness of the Marpe in achieving nasal volume expansion up the vertical axis of the nose. But patients who present with distinctly poor nasal breathing should strongly consider the benefit of Marpe as compared to jaw surgery when it comes to nasal breathing benefits. And I'm going to illustrate. So this here is an FME, which is the latest and greatest when it comes to Marpe, and probably Dr. Namaz will tell you more about that later. And then this image makes the point that I was just making about the effect that Marpe can have on nasal breathing that maybe jaw surgery can't. So if you see, this is the before, and then that's the after. You see the expansion is going all the way up the rim of the nose, all the way up whatever you call that. But it's whereas with a jaw surgery, it would stop at the site of the cut, which is essentially somewhere near these green lines. So in jaw surgery, they cut you there, and then you can't expand above that because you're severing the expansion vector. All right, I gotta speed up here because I'm running out of time. All right, option 4. The fourth approach to 3D jaw maximalism skips Marpe altogether. It involves a 3-piece maxillary segmental osteotomy to both advance and widen the upper jaw, a BSSO to advance the lower jaw, and later SFOT and dental expansion only on the lower arch. This approach hinges on the fact that orthodontic surgeons are quite proficient in doing multi-piece upper jaw surgeries to both widen and advance the upper jaw. Most of them offer this as an option. But multi-piece lower jaw surgeries are actually much rarer, which means dental expansion is still needed to get the lower jaw to match. This Marpe-less approach appeals to those interested in speed and efficiency, as they can get a Marpe-like result without going through a multi-year orthodontic process. For example, many patients have bites that suit a surgery-first approach that allows them to go into surgery immediately without doing any preparatory orthodontics. So why would they seek out a Marpe with its cost, its known risk of asymmetry, its difficulty in splitting adult males, which of course often requires its own surgery, and 2 years of associated orthodontics, when they could go into surgery tomorrow and get an arguably more precise, more predictable expansion in 3 or 4 hours or less? Sure, the segmental Lefort does not provide the desirable zygomatic enhancement that Marpe does, since the lever arm of the expansion is severed at the site of the Lefort cuts beneath the zygomas, although this can be ameliorated with malar implants such as those done by the prominent jaw surgeon Michael Dunson in Los Angeles. And as mentioned before, theoretically, Marpe does have the potential to expand more of the nose up the y-axis. But are these reasons enough to warrant the time and hassle of Marpe? More and more patients are asking that question. Okay. And here in this image, you can see, this image is actually from Dr. Alfie, who's a prominent jaw surgeon. And you can see in the image, see how much wider the upper arch has been made? So that was accomplished surgically. It was advanced and widened, but then, a simple one-piece jaw surgery was done on the lower, and so this patient will need to undergo significant amounts of dental expansion with the support of SFOT to get that lower arch to match. That's what we're looking at. All right, option 5. This one is the big kahuna burger. This is a 3-piece maxilla and a multi-piece mandibular surgery, but let's just call it a 6-piece mandibular surgery, because that's the kind of surgery that Dr. David Bell does, whose images I'm going to show in this slide. So the 5th and final approach to 3D jaw maxillas that I will discuss today is a 3-piece segmental maxillary surgery combined with a multi-piece mandibular surgery, such as Dr. David Bell's 6-piece mandibular surgery. Other surgeons do this too, besides Dr. Bell, but not many. This is complete and total reconstruction of both jaws in one day. Widening, advancing, re-angling, a whole 3-dimensional shebang. Specifically, what is unique about this approach is the mandibular skeletal widening. This type of widening that Dr. Bell performs is not at all like mandibular midline distraction, also known as MSDO, as MSDO widens the front of the jaw, but does not widen the proximal segments, which are pieces that are at the back, still attached to the skull, that are pertinent to the temporomandibular joint. Shukai, who's a very prominent yet anonymous Redditor who comments on this type of stuff, and who's, I think he's, I heard that recently that he's actually working for Dr. Bell now on helping him create some of these gifts that I'm going to show you. Shukai has argued that MSDO is an unnatural kind of mandibular widening that has very limited airway and aesthetic benefits, if any at all, along with a greater risk of TMJ complication. But Dr. Bell's manner of expanding more closely mimics natural mandibular growth. He widens and arranges the proximal segments in a manner that produces better aesthetic and airway outcomes. And without stressing the TMJs, I want to show you what that looks like. You can see in this GIF. Check out this mandibular widening. It's unreal. And the TMJs are, their position, of course, is accounted for here to make sure that they're in the healthiest posture position after surgery. Boom. And this is what it might actually look like on the patient. And then check out this airway benefit. Yeah. So, of course, the downside of this approach, the recovery. There's a lot of bone cutting and a lot of plating, and more plates means increased risk of infection. Soft tissue draping into the site of the bone gaps would also be an issue if the bone movements are too much. But if you could wave the magic wand over your own head and you wake up 6 months after a surgery like this, and having had it all go well, no complications, that would be some result, wouldn't it? So, now that we have reviewed 5 approaches to 3D jaw maximalism, I will leave you with one question. Who's ready to have their jaw cut into 9 pieces? Thank you.